Today on the Dr. Steve Show, would you go to a dentist for Botox or a gynecologist for a breast lift? Why more doctors are offering services they may not be qualified to perform. What you need to know before going under the knife.
This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Imagine going to your gynecologist for a breast lift. How about your dentist for liposuction, or even worse, your neighbor for a butt-boosting injection? Well, more doctors, regardless of their specialty, are expanding their practices to include cosmetic procedures. Well, the results aren't often what patients bargain for. Botched procedures have been all over the headlines. This Miami woman is facing charges after police say she allegedly injected patients' buttocks with a substance consisting of cement, Fix-A-Flat, mineral oil, and super glue. Police in Philadelphia arrested this woman for allegedly administering illegal butt-boosting injections, which may have caused a British woman's death. Cops say both of these women were unlicensed. That wasn't exactly the case for Yelena Elena.
You really don't get true information about the procedure on the internet, that's for sure. Everybody is advertising their procedure as the best and no side effects and no downtime. So I decided to go to this place where the doctor was experienced.
The 58-year-old female neurologist had a thread lift performed by an oculoplastic surgeon.
You put the actually threads under your skin and pull it up a little bit, and it's supposed to elevate your jaws a little bit.
She was unhappy with the results.
However, I was not happy with the procedure. First of all, it was not perfectly symmetric, and second of all, it was slightly visible through the skin.
A 23-year-old medical student who asked not to be identified had lipomas of the thighs, hips, and buttocks and wanted them gone.
It was pretty painful. I was an athlete in college, and it wasn't something that was, disabling, but it was something that bothered me pretty much daily.
He was treated by a dentist who advised him to have liposuction.
He assured me that he could use a cannula for liposuction to make a very small incision, suck out the bulk of the mass and then scrape the capsule, and that there was a decent chance that there would be no recurrence.
The surgery was not successful.
As I started feeling, a little bit further out, when I really started pressing around, realized that pretty much all of them were still in my legs, that they actually weren't gone. And I went to go see a doctor who said, these are in no way, shape, or form gone. They're still in your legs.
The patient learned a painful lesson.
His website is very misleading. It says board certified and it says plastic surgeon, and he is board certified, but it's in otolaryngology, and now he practices plastic surgery without training.
Well, joining me now to talk about this is plastic surgeon Dr. Adam Schaffner, who actually did corrective surgery on both of the patients you just saw in that piece. Dr. Schaffner, thanks for joining me.
Thank you so much.
So, shocking to me, first of all, that these two people, both medical people, fell for this. What did you do for Yelena, first of all?
Well, she's an excellent individual who really tried to go ahead and get a procedure that she wanted and to have the result that she thought would make her happy. And unfortunately, the procedure was performed by a doctor who was not a plastic surgeon and maybe didn't have the skills, the knowledge, or the training to give her the result that she wanted.
So did you have to, is it tougher to make her better, or was it more of a challenge now because someone already kind of botched it?
Absolutely. It's always more difficult to do corrective surgery than it is to get it right the first time.
And what about the guy with the lipomas, another medical guy who you would think would be smart enough to know? I mean, these people should know what to look for.
Just because they're healthcare professionals or they're studying to be a doctor doesn't necessarily mean that they know how to navigate the waters within the field of plastic surgery.
So what's going on here? Is it just as simple as greed and money? Are these guys just looking for a little extra bucks for their practice because they're not making it with their regular practice?
Well, I certainly think that finances come into play. There is a tremendous movement for non-plastic surgeons to start performing cosmetic procedures. And the bottom line is that's the bottom line of their own practice that's not generating enough income. and therefore they're looking to other alternatives.
Right. All right. So what's the advice you give to patients who are going to considering plastic surgery or any kind of procedure of any kind? What should they do?
Do their homework. Make sure that their plastic surgeon is a plastic surgeon. And you want to make sure that the plastic surgeon that you're going to specializes in the procedure that they're interested in having.
All right. So don't be afraid to speak up. That's what I always tell people. You know, believe it or not, so many people are afraid to just ask a doctor a simple question. Dr. Schaffner, thanks so much for coming in. Really appreciate it.
Thank you.